If you've been anywhere on the internet, you've heard that metformin can create havoc for your stomach and GI tract. It's not unusual when you're first starting metformin to have upset stomach or possibly lose stools. There are some tips and tricks I'd like to share with you that may make it easier for you to manage your metformin therapy if your physician has made this recommendation. The first trick is to start off slowly. Take a 500 milligram tablet once a day for about a week, and then gradually increasing it to twice a day once your stomach is okay, and then in a third week up to 3 times a day. Once you're tolerating 3 doses or 500 milligrams, your physician may switch you to 850 milligrams twice a day, and once this is tolerated, if necessary, increase to 1,000 milligrams twice a day. It's important to take metformin on it's important not to take metformin on an empty stomach. For that reason, I tell my patients to take their metformin with a meal, and if they're skipping a meal, it's probably best to skip the dose. If you're taking with a full glass of water, or if you can tolerate milk with milk, you'll find that your stomach will be a little bit calmer when you take the medicine. After a period of about 6 to 8 weeks, most people find that the metformin GI distress is no longer a factor. Another important thing to remember is the better you are at following a low glycemic diet, the less likely you're going to have upset stomach from metformin therapy. But as someone who's taking metformin, I can tell you if I cheat on the low glycemic diet, I'm going to pay for it later in the day with an upset stomach. So you'll have an easier time if you build up your metformin gradually, if you take it with a meal, that you skip a dose if you're going to skip a meal. Also, follow the low glycemic diet. And if you're going to have an X-ray dye study or undergo surgery, make sure your physicians know that you're taking metformin therapy. It's a good idea to stop metformin for a few days after one of these treatments. If you are a diabetic, make sure your physician is aware so that they can take other steps to control your sugar levels.